Hello, all. So I wanted to talk to you all a little bit more about my EPPP experience. I uploaded a video yesterday on the day that I took it, January 6th, talking about, um, my EPPP journey a little bit. It was already a long video, and so I wanted to come on here and talk a little bit more about my EPPP journey. As I talked about yesterday in that video, I started studying around March of 2024, on and off, on and off. And so to tell you a little bit about what my test strategies were like, so I was, funny enough, I was using ChatGPT to study. What I would do is, okay, let me tell you this. So one of the things that I did to begin studying, because I did not know the complexity of this test, one of the things that I did is I went on to AATBS, I believe that's what it is. They have a list of the top 10 theories and concepts from each of the 8 areas of the EPPP. So biological basis of behavior, clinical psychology, all of those things. They have the top 10 concepts and theories from each of the 8 categories of the EPPP. So what I did was I made a list of all of those theories and concepts. I made myself a Word document of all of those things, and then I looked for resources online that had to do with those things. So if it was talking about what are the heuristics and all of those stuff, I would make a list of those and in that Word document. And so one of the things that I use ChatGPT to do is I use ChatGPT to ask me like EPPP style questions. I typed into ChatGPT, I want EPPP style questions on research and stats. And then it would generate EPPP style questions. And I was thinking, ooh, this is going good. I'm doing well. This is amazing. I'm going to pass the EPPP like this. This is fantastic. Then I took my first practice test. Again, it was the very first one that I took was the Prepjet 100 question test that they had. 34%. And I was like, what in the world? I then took the PEPO. It's the online EPPP offered by the ASPPB. I took that maybe in August or so, and did not pass it at all. Wasn't even close. 34, 35%. And this was, again, after doing the practice questions on ChatGPT, having the AATBS top 10 theories and concepts, thinking, ooh, I'm doing good. And when I got the score back, and I'm going to insert a video because after I took the PEPO, I made a video because I was feeling quite down about my score after all of the studying that I had done and thinking that I was doing so well. I'm going to insert that in now. Hello all. So I wanted to make this video just talking about my EPPP experience so far. So I have been studying on and off since March of this year, March 2024. I've been studying on and off. I've been studying a little bit here, a little bit there. Then there will be times that I haven't really been studying at all. And then I would get back into it, this sort of thing. I was initially supposed to take the EPPP on July 31st of this year. I realized that I really didn't study as much as I should have been studying. And so I pushed it back to September 17th. Now, I have been studying, quite honestly, I guess I've been studying on and off in July. I've really been studying really hard this month in August. And I was actually feeling quite confident in the knowledge that I had. But I got a reality check yesterday. I was taking, it's August 28th right now. Yesterday, August 27th, I took a practice exam. Took the ASPBB, whatever. I took it's called the SEPO. It's basically the practice EPPP exam. And so I did awful on that. I made a 35%. I was like, wow. Even on the exam questions that I got right, the majority of those I just guessed. So, I mean, the questions were, a lot of them were asking about concepts, theories that I hadn't even been introduced to. Like I didn't have enough of a knowledge base to even be able to logically deduce what the answer may be. I couldn't even make an educated guess just because the knowledge base that I have currently just wasn't even working. So there were very few questions that I think I was honestly like, yeah, I know that answer. So I wound up taking a Prepjet practice test right after the SEPO and got a 36 or 7 on that. So that 35% is pretty accurate. Even on the Prepjet practice test, I didn't really know how to even break down the answers enough to be able to pick out the answer. Now, there were a lot of statistics questions, even the scenario based questions on like ethics and stuff. I was like, I don't know. I mean, this can really go either way. I mean, it just was, the way that these questions are worded was giving me trouble. And I knew to an extent that was going to be the case. I didn't know it was going to be to this extent that I was going to have trouble. What I practiced was trying to logically break down the answer choices. But the nuances of the answer choices, it's so nuanced that I really had trouble breaking it down. So I moved my test back immediately to December 27th. And so right now I'm kind of just regrouping and trying to see what exactly I need to hone in on my study, how I need to really tap into the nuances of these questions. I'm just really doing all that right now. There's a knowledge base gap that I really have to work on. I'm really going to have to get some more foundation. I've been studying parts of the brain, lobes, neurotransmitters. I've been also studying pharmacology. I've been studying a lot of the theories, going over it. Now, I know some of the theories, because, I'm a school psychologist. I also have a degree in clinical mental health counseling. And so while I am familiar with a lot of the theories and stuff, I had to brush back up on a lot of that stuff. And then the way, again, that they ask the questions, I'm like, I don't even know that aspect of this theory. And so it's so like, it's almost like they take a theory and then they take an aspect of the theory that may not be as well known and ask you a question on that. It's so interesting. It's so abstract that I'm like, I don't even know what you're talking about. And so that's kind of how it kind of works. So that tells me that I'm gonna have to know these theories inside out. Um, the issue is that there are so many theories, and the theories, a lot of the theories that they were asking about, I've never even heard of before. I'm like, these um very old theories that I'm like, I've never even heard of these people before. So that's kind of what my journey has been thus far. As disheartening as that may have been, I'm regrouping. Like I said, I set my exam back to December 27th, and so I have some time to um, build up my knowledge base, but then also constantly test myself on sort of how these questions are going to be asked. So that's where I am now. I'm going to be tracking my journey until September. Now, if I feel like I still am not ready by December, I will push it back again. You get if you reschedule within 32 days, you don't have to pay anything. And so I'm going to be monitoring myself and testing myself and doing the practice exams, um, and so that I can kind of see if I would be ready in December. If I'm not ready, I'll push it back another couple of months, and I'll continue to do that until I really feel like I'm ready. It's a very costly exam, and I'm not going to waste the 700 whatever dollars I spent on this test. I don't want to take it again. I want to be one and done with this test. It's a lot, and it's very expensive, and I know that if I just continue to work hard, I've been like for this past month and a half, I would say I've been really cramming information down. And so what I'm going to do is I'm going to make sure that I'm not studying as much in a day, but I'm kind of breaking it up and again getting a wider knowledge base, really getting deep into the theories. Um, I'm also going to strengthen some of the areas that I really don't know, which quite honestly is most of it. If I get a 35, I mean, it pretty much showed me that I need help in every single area. So that's kind of where I am now. It's August 28th. I'm going to continue to update you all on my journey to pass the EPPP. So you just saw that video, and I just was feeling pretty down after that, and I just really didn't know what to do. So I continued. I got on to like simple psychology or simplypsychology.org or one of those, and I got on a few different other sites, I think maybe Quizlet and all of these things. So trying to find resources, EPPP resources or theories and concepts and those sorts of things. And I kept studying and studying and studying. I retook the PEPO and got the pretty much the same exact thing, 35%. And so I was like, what is going on here? Like, why am I not making any progress here? Like, I have these concepts and stuff, but I'm not understanding any of this stuff. I wound up ordering some like 4,000 EPPP questions or something. It was off of Amazon. And I utilized that. That wasn't working. And so finally, I was just like, okay, I got to get with one of these test prep companies. And I asked around, and that's when I had known about Prepjet, and I knew about some of the other ones, but from everybody that I was talking to, they were using Prepjet. So I got my Prepjet subscription in early October, took my first practice test on Prepjet, the full length one, got a 34%. I found out about the Prepjet method, or the Prepjet study plan, which involves the big six. And a month later, it was November 9th, after studying physio and studying psychopathology, I did my second exam, and I had a 60% on there. And I was like, okay, this Prepjet, they know what they're doing. So I took the test after that. My third test, I took, I guess about December, I don't know, maybe December 10th or 11th or something like that. And so then I got a 53% on that. That was a more difficult test. So I studied some more, got through ethics and got through org psych. I took another test. I got a 61%. So I was pretty consistent. I wound up taking another exam, I would say about 2 days before I took it was this past Saturday, I took another exam, got a 68%, and my exam was yesterday. And I got exactly a 70%. I got a 500, a score of 500. So my study habits and my study methods, I study 2.5 hours every single day. My study strategies were to literally copy information down. I had a hard time putting stuff into my own words, but what I did with some of the content was I made up stories for some of the content, especially for areas of the brain and those medications. I made up different stories for that. I made flashcards for other things. I just wrote down information on org psych, ethics, or actually I didn't copy any information down from ethics. I just literally read the content. I listened to the content, and I just did practice questions on the ethics. I just continued to do practice questions because the ethics questions are so ridiculous. So I had many different strategies. So let me just tell you one thing about the medications and stuff. There's a lot of medications. There's a lot of side effects. There's a lot of classes of medications. So let's just take the benzodiazepines for one. So if you notice, the benzodiazepines, the ending of all of those are PAM and LAM. And so my story for the benzodiazepines was that, okay, so because they're also GABA enhancers, right? So my story for that was Gabby met with the PAMs and the LAMs. And so that helped me to remember that benzodiazepines, they're PAMs and the LAMs. And some of those specifically are, I know Ativan is one of them. Heck, I can't even remember now, and I just was studying this. So that's how you know that you can quickly forget this information. But anyway, I say that just to say that I made stories up for some of the things. I just strictly wrote down information down on some of the stuff. I made flashcards for other things. And so that was just how I studied, and I passed. Prepjet really does work. It worked for me. It worked for me, and it has worked for a lot of other people. Prepjet is not sponsoring this video, but they really did help. They really did help, because after having studied at first on and off, and then really studying intensively and not seeing any progress at all, turning to Prepjet helped me tremendously. And I did it in 3 months. They the president of Prepjet, he says, you can do it in 3 months. I started Prepjet. I took my first test on October 4th. I took my exam on January 6th. So almost to the day, 3 months, and I passed. So it really does work. Please reach out to me if you have any questions. I'm happy to talk about my test experience with you, and talk about just overall, if you have anxiety talking about this test or taking this test, studying for the test, please reach out. I know you need support. It's a test that is just, it's exhausting, but it's doable. And I wish you well on your EPPP journey.